Today I want to talk about a recently published article in 2025 by Bhargava and Ashwin. They investigated barriers to autism diagnosis in adult women. And what they observed was that there were three themes that emerged in terms of barriers to obtaining an autism diagnosis for adult women. So one barrier was gender bias. So gender bias both in terms of the diagnostic criteria as well as gender bias in terms of the bias that health professionals might hold. Secondly, they found a theme that indicated diagnostic overshadowing. So what I mean by that is that often women who qualify for an autism diagnosis receive one or multiple different mental health or health diagnosis prior to that autism diagnosis being confirmed. And diagnostic overshadowing really refers to the fact that those previous diagnoses keep influencing subsequent diagnostic assessments and thus make it in a way less likely that autism is diagnosed and more likely that a previously raised diagnosis is confirmed. Finally, there also was a theme that emerged in terms of systemic barriers. So again, this refers to things like diagnostic classifications not being gender inclusive necessarily, assessments often having to be done under some kind of time pressure or at least a time limitation. Then finally, when they looked at facilitators of autism diagnosis, what they observed was two themes. So one theme was acknowledging heterogeneity in autism that really facilitated a swift and accurate diagnosis of autism in adult women. And the second facilitator was integrated approaches to autism referrals, right? So not having different elements of the healthcare system working in isolation, working as their own silo, and not seeing different diagnostic criteria as being in their different diagnosis as being their own silo, right? But looking across diagnosis, working across different institutions, etc., and different levels of the health system really facilitate an autism diagnosis for adult women.